Hello, my name is Rosa Marazatadas, and I am the Global Director for Program Strategy and Partnerships at IC3 Institute. We're accompanied today by Dr. Daniel Tubon Garcia, who is very immersed in the field of career counseling and well-being. Dr. Daniel Tubon, can you tell us a little bit about yourself and your experience? What led you to this, where you are now?
Thank you so much, Rosa. Very happy to be here. I'm from Colombia. I'm a medical doctor by training, but I've been working in an intersection between education and health because mainly my focus is to ensure that every child gets the support they need, especially throughout the school years. My passion, my obsession stems from my own experience growing up and experiencing bullying when I was in high school. It was a barrier. It was something that was very significant in my life. And I think that if I would have been in another scenario with different circumstances, maybe my story would be different. But fortunately, I was able to escape that situation, get the support that I needed. And I went on to study medicine. And then I started seeing that my experience was not only my experience. There are millions of children, adolescents, and young people who just every day can see their lives and lives projects threatened by situations that we can prevent, detect, and address in the school setting and in that time in life. And it's strongly correlated with school dropouts, with student accessing higher education and staying in higher education or dropping out. And so I became obsessed with the idea that every school and every school environment should be safe, healthy, protective, and that every student gets the support they need. And that's why I've been working for more than 10 years in the field of adolescent and youth health, and lately, particularly supporting schools assess, monitor, and improve school well-being and student well-being
in the future. So can you talk a little bit more about the data and the tracking and the importance and a lot, maybe starting by what schools miss? What are schools not doing or not doing right? Yeah. Because we see a lot of schools saying, we're doing well-being, but are they really doing well-being?
Yeah. So it's really striking for me that very few schools are able to tell me what the well-being situation is for every student. We're able to know how they're scoring in math, in language, in robotics or informatics, but very few schools can tell me how a particular student has been feeling lately, apart from those that we already have in our radar. And the issue there is that the decisions in life go way beyond the decisions that we have to make in terms of where we're going to study, what university we're going to go to. That sort of is kind of trespassed by other dimensions in life, how I'm feeling, the environment that I'm in, if I want to live with my family or not, how I feel in my city or I want to move to somewhere else. It relates closely with the abilities and the skills that I have to make those decisions and to face uncertainty. But it also relates very closely to my personal health, emotional, physical, overall health, the environments that I'm in, and the relationships that I'm able to build. So oftentimes what we're missing is how the student is doing. And we put so much pressure on the students, a 16, 17, 18-year-old kid making decisions that, they perceive as, the decisions of their lives. I get very often, I'm gonna move away from the work that I do. I have a cousin, a very, very young cousin, and she wasn't sure about what she was going to study. Or should I study psychology? Should I go to nutrition? It's such an important decision. They feel so much pressure from their families, from their schools as well. They need to, in the newspaper at the school, they need to tell what's their career that they're choosing. And sometimes it's like a testament of what they're going to do for the rest of their lives. It's not that big of a deal. Not that big of a deal. I studied medicine. I thought that I was going to become a medical doctor and work in a hospital and a clinic. It turns out by the 5th year in medical school, I decided that my passion relied in public health. And I loved clinical work, But, it came really old really quickly. And I was very interested in social causes. And public health seemed to be a great fit for me. So I then went and got very involved in public health as a medical student, did many things, research, advocacy, community work. I did a master's in public health. And then what do I know? Now I want to become an entrepreneur because I thought that there would be other ways and mechanisms to make an influence and a change in the world in a sustainable way. And I thought the business perspective and the private sector would have many teachings for us. And so I took the learnings and the experiences that I got in medical school. It gave me a depth of knowledge. I know what I'm talking about when I work in the field of school health and well-being. But I also learned a lot studying public health. And so I think what we're failing to miss is that, where relies the true passion? What are the motives and the intentions that the children have? And just to reassure that, no decision is permanent. The most permanent thing in life is change. And so trying to understand how they're feeling, how are they experiencing the pressure that making this decision has in their lives? How's the environment that they're in at home? Why do they want to go away? Is it because they're in a violent environment or not? Are they feeling safe or unsafe in school? So I think those things we're missing out, and just be mindful that many of the kids that drop out and that change careers is because they're not feeling well or right. And so just connecting with the humanity. And you can track that. There's ways and indicators where you can measure what's happening, but also connecting with that other person.
What kind of policies should there be, maybe at a country level or a regional level? And mentioning your background in policies, what would you say is important for us to keep at the forefront of the conversation?
Yeah. But before we get into that, I wanted to say something is that I get from schools and from families this cry for help right now. It's like the mental health situation. It's the need of the hour. We don't know what to do. What's happening with today's generation? My generation didn't have that. We also face different problems. The kind of pressure that we're putting on students to plan out their lives at age 17 and 18. Yeah. We make them believe, even though sometimes we tell them, oh no, it's not only about your grades, your career, your jobs, but we force them and we push them to make these decisions. Do you know the kind of pressure that means for any particular person to identify themselves only as a profession, only related to what you do, not who you are? And it's happening with many, many people, adults and younger people, who at some point become burned out with their jobs, with their careers. And sometimes it happens that they are laid off, or something's happening in the tech world and, massive layoffs, or they need to change jobs, or they can't keep up. And so they take a semester off. When that part of their identity is taken out, so I'm not a student anymore, I'm not a medical doctor, then who am I? Who am I? And then we question and we ask ourselves, why are we in a mental health crisis right now? Because we've infused an identity that is solely focused on what we do and what we've accomplished, not who we are.
Correct.
I've struggled with mental health throughout my life, and my psychologist one day said, everything that you do is great. If you want to do it, do it. It doesn't define who you are. You can just be at home. You can grow your food. Some people just do that, and that's perfectly fine. If you're able to do something that is meaningful for you and you're able to provide a livelihood for you, you don't need to change the world to be meaningful, to be important. And so I just really want to emphasize that for us to be really careful when we talk to our children, when we talk to our students, to ensure and reassure that they're valuable, they're worthy, regardless of what they do.
That's true.
Regardless of what they achieve. regardless of the titles, regardless of the certifications, they are meaningful and important. Because if we don't, what's going to happen is what's happening right now. Their whole identity is related with their doing. We're human beings. We're not human doings. We're human beings. And if for some circumstance in life, and this happens all the time, we lose our jobs, we need to move away, we need to change careers, we can't lose our entire identity.
Correct.
It's only a part of it.
Correct.
So I just really wanted to emphasize that so that everyone hearing us out is cognizant that we're dealing with human beings, not human careers or human professions, human beings. And so kind of transitioning and using this as a segue to the question you asked about policies, I think it's very important for schools, particularly, and families to express very explicitly that we care about human beings. That's the first thing. Policies is not only the thing that's written in a document, it's what we say. Our discourse also shapes the policy. So just expressing very openly that you're here to... So I was giving a session this morning and someone said, the well-being is not only an agenda, it's the only agenda. So if you express very openly that you're here to protect and to ensure that children get the support they need whenever they need it, on whatever thing they need, that will create a space, a physical and a psychosocial, like a cultural space, where children feel that they have someone to talk to, that if they're in doubt, those doubts will be well received. And if they want to rant, if they want to complain,
there's a place.
There's also a place to do that. And that can be followed up with certain protocols, and certain good practices to understand how every child is doing. So it is important that schools have policies in place so that whenever an incident happens, we know how to deal with that, who to turn to, what's the pathway that we need to follow and continue. Policies regarding curriculum development, so that counseling is not only pertaining the counselors, which are very few, it's kind of sort of streamlined across the different other aspects of school life. So when we're talking about, mathematics, when we're talking about different subjects, then we're able to incorporate decision-making and different life opportunities that one could have, irrespective of the career that you choose. Because the skills that you obtain, the knowledge that you obtain, can be used in whatever way you see fit. So if that can be incorporated in the curriculum, in the teacher training, in the partnerships that you create with other actors, with community actors, with the private sector, with the public sector, then you'll be able to ensure that counseling and career counseling and life counseling is streamlined across school.
And you said something that has made me remember the incorporation of stakeholders that you didn't even think were really vital. And what I'm referring to is how we shape the narrative. So working with marketing departments in schools and how you share the achievements is a way to, where do you put the focus? Are we only focusing on those students who achieve certain standards? For example, how are we reporting the destinations? Are we only reporting those destinations that are within a certain ranking or within a certain field? How are we reporting? Which students are we choosing to showcase? And I'm sharing this because the language that we use is important. I remember a school and best practices that changed the language from saying, these students have been admitted to this institution, to saying, these students chose to attend these institutions. So the agency is on the student and the agency on the decision-making process, whereas not the value of the institution you're attending to. You made me think about that because there are ways that we can immediately make changes and shifts in our language and the way we approach and the guidelines that we process. And so conversations like these allow us to think big and think low and allow us to continue talking. So I'm really grateful for the time together, Daniel, and I'm hoping that we can connect with you once again in all the work that you're doing. And if you would leave a final piece of advice or reflection, what would it be to let's say, folks who are interested in supporting students in career guidance and making decisions for their futures? What piece of reflection would you like to leave them with?
Yeah, thank you very much. Three things I would leave. The first one would be incorporate other voices. Mm-hmm. Counselors are trying to stay updated, out there, trying to show opportunities for adolescents and young people. But in today's world, where children and adolescents are more concerned with climate, with feminist movements, with racial movements, bring those voices into the table, bring them to school so that they can see other pathways, other routes, other alternatives that will inspire them and show them a clear and concrete and practical ways to engage with those decisions. If I had a person come to me and say, you don't need, you can study whatever you want and you can still change the world.
Right.
And I studied medicine, but then I did that, or I studied law, or I studied communications, but then I moved into something else and I'm using what I learned into this new venture or this new project. I think that would be really incredible. So engaging underrepresented voices, those voices that we don't hear a lot. Maybe step away from the usual career counseling and go away to the people who are doing the work, practitioners, bring them to the table. So that's one thing. The second thing is that try to see the student as a whole. So there are good practices. There's a school in Switzerland, Ecolint. They developed something called the Learner Passport. Mm-hmm. So we say that we don't only care about academic scores, but then we don't have a specific way of measuring it. They developed this Learner Passport where the student can create sort of like a resume with different competencies that are related with today's world. Mm-hmm. Engaging with different technologies, multiliterateness, decision-making, leadership, so that not only the scores count, but my volunteer work counts, my special projects, the sports that I'm engaged with. So try and develop something that can help the child and the student show a more comprehensive picture of who they are, their interests, so that they can go and, when they do the essays, when they're applying for a school, maybe they can show a bigger picture. When they're applying for internships, maybe they don't want to go into school right away. Maybe they want to engage in more practical work. That will be able to enable them to show a wider perspective, a more comprehensive perspective of who they are. And it will help them to get them to know themselves even better. So that's the second thing. And the third thing is try and lower the pressure. Lower the pressure. It's not that important. We're here for the long run. This is a marathon. This is not a sprint. And I hear counselors a lot saying, oh no, it's application time. It's hectic time. It's like a few months where everything is just crazy. No one's going to die because of this. We're here for the long run. We're planning for 10, 15, 20, 30, 40 years. We're not planning for the next 6 or 9 months. So just lower the pressure. It's okay to take some time. It's okay to breathe and to connect with the other person. So those 3 things I wanted to leave with you.
Well, and these are 3 things for now. We're hoping to get you back and hear more from you. So thank you very much. And we're so excited to have your advice and collaborate with you in the future. Thank you, Daniel.
Thank you so much for having me.